this workshop with us today, where we'll be learning about understanding ADHD in women, right? So I will be your tour guide today. My name is Tamiki. I am a I'm a practicum intern or with Dr. Tamara Edwards working in her practice while I also pursue my doctorate in clinical psychology. So this is an exciting time. I am also a licensed professional counselor here in the state of Georgia and registered as a provider in the state of Florida as well. I enjoy working in private practice, and I have been doing so now for several years. Um, I'm learning more and more about neurodivergent behaviors and just neurodiverse or neurodevelopmental disorders while working under Dr. Edwards. So I am very excited, a little bit nervous, but very excited to be sharing some of the things that I've learned along the way with you today, specifically, as I stated, about ADHD and how it shows up in women. Just as a disclaimer before we get started, during today's presentation, I will actually be discussing ADHD as it affects women and people assigned female at birth, regardless of affirmed gender identity. Terms of reference that I will use today include girls for those individuals who are under the age of 18 and women for those who are over 18 years old. In the same sense, when I refer to men and people assigned male at birth, this is who I'll be referring to when I use the terms boys for those under the age of 18 or men for those over the age of 18. I just wanted to make sure that we were clear on that before getting started. The objectives for today's webinar include just gaining a general understanding of ADHD and the subtypes, disparities that exist in diagnosis of this disorder, the ADHD symptomology, and understanding this disorder beyond um, its stereotypical image and how we've all probably come to learn what it should look like throughout the years. Also identify common ways in which ADHD manifests differently in females. Understanding the impact and implications of underdiagnoses of ADHD in women, and identifying available treatment options and strategies. So, worth our attention, I wanted to bring our attention to the fact that treatment costs for ADHD are pretty astronomical when you sit and take a look at it. Based on estimates from research, the annual cost in the United States for ADHD, and that includes healthcare for the person who actually has a diagnosis of ADHD, for family members of those individuals with ADHD, and the work absences and how that actually costs the economy. The estimates are that ADHD costs about $32 billion, at least in the United States each year. So when we think about that and the underdiagnosis of ADHD in women, it's a significant concern. It's finally starting to get more attention here in recent years, and I'm really excited about that. Excited and concerned at the same time that it has taken so long. But we're going to start with just a brief overview of the disorder and the diagnostic criteria that goes along with it. So what is ADHD? ADHD, of course, stands for attention deficit hyperactivity disorder. So it's a neurodevelopmental disorder, at least that's what it's considered to be, and that's how it's listed in our DSM diagnostic manual. It typically manifests early, and it's attributed to differences in brain processes that actually affect how an individual may interact personally and social interactions, how they are able to function academically, occupational function. So it touches many areas of their life. Just a brief look at diagnostic criteria, and this is how it is listed in the most recent iteration of the DSM, which is the DSM-5 TR. So it's characterized by inattention or hyperactivity and impulsivity, or in some cases, a combined presentation. Um, there are several inattentive or hyperactive impulsive symptoms that must present prior to the age of 12. considers that there must be several inattentive or hyperactive impulsive symptoms that present in at least two or more settings. So this can't be a situation where the symptoms are only showing up, for instance, at home or only showing up at school, but we're not seeing them anywhere else. So it has to be present in at least two or more settings based on the criteria. There also must be clear evidence that the symptoms are interfering with functioning and that they are not occurring exclusively as a result of another type of disorder, another mental disorder, or psychotic features as seen with schizophrenia or other psychotic disorders. When we look at it a little bit more in depth and look at inattention symptoms, um, six or more symptoms have to have persisted for at least 6 months. If we're working with an older adolescent or say an adult in some cases, although it's not listed that way yet in the DSM, at least five symptoms are required. And I just wanted to point out a few of those symptoms here. As you can see, they're likely to be related to attention to details or careless mistakes. Sustaining attention is going to be difficult. Maybe the child or the adolescent or the person who is affected by this is having difficulty sustaining attention. They don't seem to listen, not following through on instructions, difficulty organizing, avoids, dislikes, or is reluctant to engage, often loses things, are forgetful. And I wanted to make sure I highlighted those because those are often, and as we see later on in the presentation, those are really big factors in terms of what individuals who are affected by this type, specifically women and girls, these are some things that you often hear about their level of functioning. Hyperactivity and impulsivity symptoms, these are the ones that we usually think about. And I don't mean to speak for everyone, but I'm just saying these are generally the ones that people think about when they get a picture in their mind of what ADHD looks like. So this is the individual, or most of the time we're thinking about boys, but it's the person who's fidgeting with their hands. They maybe leave their seat when they're expected to be remaining in their seat, such as in a classroom setting. They're running or climbing on things when it's not appropriate for them to be doing so. They seem to be just unable to actually engage quietly. There's always some type of noise or racket going on about them, a lot of high energy activities. So they seem to be on the go. They may talk excessively. This is the child or older adolescent or adult who may actually be the one who blurts out answers or responses in meetings, if you think of it that way. Or they're the person who's completing other people's sentences. They have a hard time waiting for their turn to do things, and they often interrupt or intrude. And as I mentioned, several of those features actually, or those symptoms, have to be present, and to a degree that's not consistent with developmental level, and that it's negatively impacting social and academic or occupational activities. The symptoms cannot be solely a manifestation of some other mental health disorder or illness. So there are three subtypes for ADHD. Um, Predominantly inattentive presentation, which is the one that we typically tend to see when we're working with female population, and we'll get into that as well. Predominantly hyperactive or impulsive presentation. Again, this is the ADHD that tends to be like the textbook ADHD that people assume exists. So this is the one where we're seeing a lot of energy. We may see like daredevil type behavior in the child versus in the inattentive one. We see this one as she's kind of doing here in the picture, which is why I'm glad it showed up for me, because I thought it was kind of perfect. When we think about inattentive, we're usually thinking maybe like heads in the clouds somewhere and just staring off into who knows what. Then that's what I got when I saw this particular picture versus the young person or the person who's sitting here on the cliff, kind of maybe I'll jump in, maybe I'm not. These are the things that came to mind as I was setting this up. Combined presentation. Again, this is, you've got a little bit of everything going on. You've met the diagnostic criteria for not just inattentive, not just predominantly hyperactive or impulsive, but you've met diagnostic criteria with having at least six of those symptoms, or five if you're an older adolescent, that are showing up and affecting you in ways necessary to meet diagnosis. So she looks a bit overwhelmed, which I imagine it has to be what she's feeling, or anyone who may have a diagnosis of combined might get to feel that way at times. So, a gap, or is it really a gaping hole? Because when we think about what ADHD looks like and what we expect it to look like, as I've mentioned before, the everything that kind of goes with that research, treatment, everything has been focused for so long throughout history on what it looks like in males. Diagnosis in childhood typically is based on a child's problematic behavior, or a teacher's referral, for instance. Um, so this again is going to rely on observation most of the time. So these are things that they're seeing that the child is doing outwardly, or maybe they're not doing on those occasions when maybe a girl or a female or someone who has an inattentive type is referred. They're not paying attention. These are observable things that usually result in a referral for that child to receive the attention they need, the assessment they may need for diagnoses. In adults, even though the overall incidence of ADHD remains small in the adult population, the incidence in 30 to 49-year-old group has nearly doubled, from 0.34% in 2020 to 0.64% in 2022, according to some recent research that I found. And I think that is actually a little bit scary and amazing. It just makes me, again, wonder what people have had to go through prior to finding answers. Much of the increased incident in the adult age group can actually be attributed to increased diagnoses for females. The incidence of ADHD diagnosis in the 23 to 29-year-old age group and the 30 to 49-year-old age group for female population nearly doubled between 2020 to 2022. And this is supportive of findings that females tend to be diagnosed with ADHD later in life than males. So there's also some research that has suggested, not certain on the actual numbers or if it's actually going to be something that holds up, but there's research that's looking into the fact that the recent shortages in a lot of stimulant behavior could be tied to a drastic increase in the number of ADHD diagnoses. It seems that a lot of people were recognizing symptoms about themselves, or actually finally reaching out to get help for things that they were struggling with in the years when the pandemic was hitting us the hardest. There are also racial and ethnic differences that we have to consider in terms of research and treatment and diagnoses of ADHD. The National Health Survey conducted between 2016 and 2018 actually revealed that African American and Latino children have lower rates of diagnoses and medication or treatment when compared with white children in the same age groups. We have to consider that socioeconomic status, cultural beliefs, language barriers, and access to healthcare, they all contribute to disparities in terms of individual receiving treatment and, well, initially a diagnosis for ADHD. And overall, we also have to consider that there are so many stereotypes and biases that actually contribute to underdiagnosis of ADHD. So when we take a look at the impact of bias, just how much has it actually impacted individuals, especially females, women, and girls actually receiving a diagnosis? We have to consider the historical implications, the belief that ADHD is predominantly a male disorder. Um, it affects proper recognition and treatment for women with ADHD because we've simply been overlooked. Research has predominantly focused on how ADHD presents in males, and this actually goes back probably as far as when ADHD was first started to be mentioned in some medical case presentations. The focus was on behaviors that were being observed in primarily male children. With the DSM, even in the most current iteration, which is the DSM-5 TR, there's only been minor changes that have been included. And typically, there's been minimal training. When we consider some of us on this presentation today are professionals like myself, I can only speak for myself, but from what I've heard from counterparts as well, colleagues, typically there's minimal training regarding gender differences in ADHD. With a lack of training on what to look for in women, many of us just continue to actually be left undiagnosed and untreated for ADHD. There's also the impact of implicit bias to consider. Um, Educators have exhibited implicit bias when identifying ADHD symptoms in children. Boys are more likely to be referred for ADHD assessments than their female counterparts who may have similar symptoms. And this is not just something that actually happens with teachers. Educators, of course, have first access. Usually, children are in some type of a formal setting where they're receiving their education. And as I mentioned, it's overlooked. But this is also something that is happening in our medical settings, like with doctors, pediatricians who are working with the children, and even in the households. Symptom misattribution. So symptoms of inattentiveness or impulsivity are oftentimes dismissed as just typical behaviors for girls or women. Inattentiveness is actually dismissed frequently as being daydreaming, or excessive talking or interrupting might actually be categorized as being chatty, right? So they never actually look, or most times they don't look at it a little bit closer to see, oh, well, there's something really going on. What is it that keeps drawing her attention, out the window or away from her lessons? What's actually there? Again, the symptoms usually are just attributed to something other than a possible presence of ADHD. So let's get into a little bit of how symptoms present. Again, we have stereotypical beliefs that are affecting what we tend to look for. The stereotypical belief that ADHD affects males only, boys. Um, that's been a consistent belief. That's just it even tends to just live and thrive on even in today's date in 2024. It's still there. And you'll still encounter people, excuse me. Thank you for bearing with me for that small pollen break there. That's what keeps affecting me. So I apologize if that happens throughout the session today. But as I was stating, that the beliefs, the stereotypical beliefs that males or boys are the ones who tend to have ADHD, it just keeps going on and on. Attitudes about behavioral norms, things like girls are to be seen and not heard, that tends to lead to girls not showing outward symptoms if they are being affected. So we'll get into that a little bit later. Um, you can't have ADHD if you get good grades. I've heard this one so many times from individuals who have already received a formal diagnosis, but that is carried out throughout the years. It's carried on as a stereotypical belief that if you're able to do your work, you're able to actually get things done, or not just in school. You're successful. You run a business. You have excelled in whatever it is that you're doing in your career. So what do you mean you have ADHD? The last one that I have listed is one that I am sad to say that I've actually heard a couple of times, more than a couple of times. ADHD is not real. It's just an excuse. So basically, if you just try a little bit harder and figure some things out, you should be able to get beyond this. There's nothing really wrong with you. Um, There's also an ongoing belief that ADHD must be diagnosed in childhood. So that leaves, I believe, a lot of adults who are actually kind of suffering in silence and not reaching out for the help that they need, especially so when we consider women. So there's a prevalence of inattentive symptoms. Females are more likely to present with inattentive features of ADHD. So, again, these symptoms are often overlooked in childhood by teachers, doctors, and even parents. And as a parent, and many of you may be parents as well, you tend to think you know everything about your child, you're paying attention. But when you have those beliefs that are already there, already implanted or implicit, then you're looking for certain things. You're not expecting her to be jumping off walls or bridges or doing things that end up with a lot of skin knees as a child, or talking a lot in class may actually be an excuse for that. Oh, she's bored, she's advanced, I've heard all of these things mentioned in real life cases. um, Females actually tend to exert great effort to mask symptoms of ADHD. And we'll talk about that in just a moment as well. So we're really good at hiding what's going on. ADHD is just one area where we're really good at just keep pushing on, keep figuring out ways to actually thrive, or as best you can, or as close as you can get to thriving without recognizing or having anyone else recognize that something is going on. So we have to consider externalizing versus internalizing symptoms. Externalizing symptoms, again, those are the symptoms that people tend to expect to see. They're characterized by problematic behaviors such as impulsivity. Impulsivity may mean the person who can't wait for the other person to finish their sentence. This is the girl or the woman who is cutting their friends off in conversations, or in the middle of a story being told by a friend or a colleague, they interrupt because they had this thought, they had to get it out. But impulsivity can also look like more dangerous behaviors as they get older, such as speeding excessively, or unprotected sex, or sex with multiple partners, or substance use. So all of those things are ways that impulsivity can show up. Rule breaking and aggression, though, and tend to be what we think about when we think about those externalized symptoms. Whereas externalizing symptoms or behaviors occur in interaction with one's social environment, the internalizing symptoms or behaviors focus on yourself, focus on one's own self. And women tend to experience more internalized ADHD symptoms, and that's a factor that contributes to missed diagnoses or late diagnosis. So when we think about internalized symptoms, again, these are things that the person dealing with the symptoms have kind of turned inward. So we are looking at symptoms that tend to lead to feelings of low self-esteem and issues that may show up as emotional problems. Maybe it shows up in the form of worry or anxiety, depressed mood. The individual affected by this, especially women and girls, they tend to withdraw, pull away from the other kids on the playground and just kind of manage yourself, or stick to yourself at work and work settings or social settings, kind of existing on the fringe in a sense, especially when they tend to be or going through times when they're feeling a bit overwhelmed. And there's also a lot of shame associated with it, because remember, you're not the person who is affected by undiagnosed ADHD. They know that something is wrong, something is off, something is different, something is causing me issues, but I don't have a reason for it. And the messages they may be getting from everyone around them is that, hey, you should be fine. You shouldn't be having these problems. So what really is going on? So there's a lot of shame that goes with it. All of these things, of course, make it harder to diagnose ADHD. So let's look at what it takes, or some of the things that we should notice in terms of detecting ADHD in women. As we mentioned, the internalized symptoms. Women with ADHD often internalize their symptoms, as I mentioned, and that can lead to low self esteem, anxiety, depression, um, instead of the obvious presentation that tends to be looking for, which is hyperactivity. The women don't tend to exhibit, or girls don't tend to exhibit, the classic hyperactive behavior that's associated with ADHD. So that makes it harder to spot. The daydreaming and distractibility. So this is the girl or the woman who actually may appear as though she's kind of spaced out. She's daydreaming. She's constantly thinking about everything except what's going on in the here and now when she's in the classroom or in conversations, or again at work. She also has difficulty focusing on task. This can oftentimes be mistaken for and even attributed to absent-mindedness or disinterest, rather than being recognized as an underlying ADHD symptom. There also tends to be a high amount of emotional sensitivity. So women with ADHD may experience intense emotional reactions and mood swings, which can be attributed to things such as hormonal fluctuation or other mental health conditions, which lead to misdiagnosis. Perfectionism. It's often seen as a positive trait sometimes, especially in situations when you're older woman and you're actually starting your career. Depending on what you're doing, that level of getting everything just right, making sure that everything is perfect, can actually lead to high rewards, which of course perpetuates the behavior. But excessive perfectionism in women could actually be a coping mechanism for managing ADHD symptoms, such as poor time management and impulsivity. Difficulty with organization. So, women with ADHD may actually struggle with organizing tasks, maintaining a tidy living space or a workspace, or even their desk, managing their schedule. This is, again, often misinterpreted. It's often seen as like laziness or a lack of effort. When you hear words like that, is in my mind, I immediately see how this could connect to the internalizing of symptoms and lead to subsequent shame. Chronic procrastination is one that we often see, and that's common in ADHD. But in women, it could be attributed to them being overwhelmed. Again, one of those stereotypical beliefs, or based on gender, is that a woman should be able to handle multiple things. Like you're used to multitasking, run the home, run your job, run the family, be a wife, a mother, all these different hats that we tend to wear, and all these tasks that have to get done, right? So it might actually be attributed to being overwhelmed by multiple tasks rather than recognized as a symptom of executive or frontal lobe dysfunction. Memory problems are also a symptom that shows up often, or a presentation that shows up often. Forgetfulness, absent mindedness are hallmark symptoms of ADHD. But in women, these issues might actually be dismissed as a normal part of multitasking or aging, rather than recognized as a symptom of an underlying condition. All of these things, and again, the way that we're perceived as females in our society, tend to lead to something called masking. Women with ADHD often develop coping strategies to mask their symptoms and social situations. And we're talking about undiagnosed individuals, right? So they may appear to be outgoing or talkative or excessively agreeable, but it's actually in efforts to compensate for difficulties they may be having with focus and impulsivity. So when we talk about masking, masking is considered to be how girls and women actually may camouflage their ADHD symptoms. Some of the common masking behaviors that are seen is a tendency to maybe hyper focus on their appearance, how they look. That's a big deal for them, and it has to be. You have to look right before you go out for anything. Even if I'm running into the store for a carton of milk, everything has to be put together. Um, Overcompensating with organization. She may become a social chameleon, but there's also I'm not taking risks, right? As that individual who's affected. An undiagnosed female may actually exhibit perfectionism and a fear of failure. The fear of failure actually is what tends to drive the perfectionism. Everything has to be right. And if you are familiar with anxiety, you know that perfectionism and that fear of failure, they tend to go hand in hand really well. Emotional regulation efforts. It may be harder for her, but she does her best to actually mask the fact that she's feeling overwhelmed, or that she's really feeling hurt by something that has been either taken away from her, or her feelings have been hurt because she's perceived something that someone else said, and she's playing that over and over in her mind. So just the efforts to actually appear as though you've got it all together emotionally. That's a part of masking. A lot of self blame, which again is an internalizing feature. So you look at yourself instead of looking outward as to what could be the cause of these things. There's a tendency for them to mask with the good girl approach, doing everything right. Again, that's in my mind, I tie that a little bit with perfectionism, just in a different way. There's a tendency to avoid conflict, lots of effort to mask forgetfulness. And some of the things that I've seen or heard about is maybe this is the person who is so worried about time management, for instance, that they set a million different timers, or they've got notes everywhere. But there's things that they put in place, systems that help them to get through day-to-day life in an environment that's not designed for the way that their brain is actually wired. Because I believe that ADHD, just like many people, is just a difference in how our brains are wired in that sense. And then again, internalizing symptoms, which we've touched on. So let's look at some instances of ADHD in real life. I came across quotes from women who were actually diagnosed, many of them diagnosed later in life. And I found it so eye-opening. And I just want to touch on some of the major parts of their quotes were really telling as to what their experience is like and some of the things that I was finding as I researched this topic. One individual said, as a woman, the symptoms of ADHD I had as a child were always named bad behavior that needs to be corrected. And I don't know about you all, but when you hear something that says, oh, that's bad behavior that needs to be corrected, that's immediately like a punch in the gut. That's immediately going to affect how you start to see yourself, how you view yourself in this world, and that's affecting your self esteem. So we have another individual who went right along with the stereotypical belief that's been passed down. When I was growing up, ADHD or ADD was for the little white boys who were literally bouncing off the walls. It's there, it's sad but true because that's the picture that most people have in mind when they think of ADHD. They tend to think of the white male child who's experiencing it, and white males are the predominant group who tend to be diagnosed with ADHD even now. I never thought I would be diagnosed with ADHD as I was a good student. And this person goes on to say that it developed more in adulthood. They got easily overwhelmed, especially during work, and had a really hard time completing a task. So, very telling and very true as to what ADHD tends to look like in women. We have an individual who said her mom tried to get her diagnosed with ADHD, but they told her that's not possible because your kid likes to read. So, there can't be anything wrong there, right? Um, but I thought my doctor wouldn't take me seriously since I was successful on paper. I think that on paper part is very appropriate for the underdiagnosis of ADHD in women because, again, a lot of the masking behaviors tend to, they just tell the story. They go along with what is expected. Well, if you have your things together and you're getting things done, you're getting your tasks done, or you're making good grades, or you're successful at work, there can't be an issue. So there's a few other ones. The one that I want to mention though is the I either start a million projects and don't finish them or shut down completely, usually both. So this is a classic symptom in my or classic representation of the symptom of having deficits in that executive functioning area where you can plan and organize and figure out what comes first, what comes next in order to get tasks done, which we know is a hallmark symptom. Here's some common psychiatric comorbidities that often confound diagnosis or women receiving diagnosis of ADHD. And I say women, but again, females in general, girls, women. There, these particular disorders, especially anxiety disorders, mood disorders, eating disorders, personality disorders, they are highly comorbid with ADHD when it presents in females, especially. Things like anxiety and mood disorders tend to actually get diagnosed first. They'll get diagnosed sometimes instead of ADHD, either leaving the person still questioning what's going on in their lives, trying to figure some stuff out, or they get the diagnosis of anxiety disorder and nobody looks any further. So when the person who has gone in for treatment or gone in for testing, sometimes you tend to take the word of the professional, even if you still feel like, well, I've got a lot of unanswered questions. They may actually exist thinking that it's anxiety that is the explanation instead of it being a more likely explanation that the difficulties they're experiencing due to the undiagnosed ADHD is actually contributing to anxiety or a depressed mood, which can show up in any of the disorders mentioned. It's also highly common for females who are undiagnosed with ADHD or undiagnosed ADHD sufferers in a sense to actually have physical symptoms. Headaches are not uncommon. Gastrointestinal issues, chronic fatigue, sleep disturbance. There's also a higher chance that they will actually have issues related to weight or obesity. So all of those things tie in with ADHD and really cause issues when ADHD is undiagnosed. There are lifelong patterns because even though ADHD is considered a neurodevelopmental disorder, it has been shown to persist into adulthood. So when we think of this, because inattentive symptoms are far less likely to be recognized, an undiagnosed female rarely gets the treatment that she needs. And these are some ways in which ADHD might actually show up in the life of that girl, or woman. So in childhood, perhaps she's making careless mistakes on her homework or her tests, especially on tests, because then you've got an added possible factor of anxiety if you're thinking in that way. But careless mistakes on assignments and tests, unfinished projects, she may be highly distractible, or looks like she's daydreaming or just spacey. Short attention span, and all of those things can lead for even the brightest student to have some trouble with their teachers or their parents as a result of the trouble that they've had in their performance at school. In adolescence and into adulthood, there's often the presence of mood or anxiety disorders. So only getting half of the instructions maybe when they're verbalized to them, because again, we're talking about a prevalence of inattentive type of ADHD showing up. So there's more of a likelihood that that focus is still off. This is the person that you might see who's doodling in class or during big meetings at work, regardless of how serious the presentation or the content that's being presented might be. They're doodling and it looks like they don't have a care in the world. They're just in their own space, drawing up a storm, when in actuality, that may be what they're doing to help them focus and hone in on what's being presented to them. And of course, there tends to be a lot of forgetfulness present still. Now, in careers and relationships, ADHD shows up in careers, especially as underachievement. Despite women or females, girls with ADHD tend to be of fairly high intelligence overall, highly intelligent individuals, but they tend to struggle to reach their full potential, either academically or professionally. And this is due to difficulties most likely occurring in the areas of organization, focused, and just follow through. Um, Again, they're still struggling at this age, and without an answer, you can only imagine the level of stress they may be enduring, or the messages that they're telling themselves about themselves because they can't seem to get things done. It also shows up in relationships in terms of, again, the failure to focus or listen or follow through on certain tasks, especially in household. Because it persists into adulthood, and because females tend to go for such long periods being undiagnosed or misdiagnosis even when they are being treated for other things, um, some of the research has shown that women with ADHD have higher risk of things such as being a target of bullying, emotional control issues such as rejection sensitivity, or sensitive dysphoria, which is not a recognized disorder in itself, but it is an explanation and a term used to describe the intense emotional responses that can sometimes be exhibited by individuals with ADHD. There is a higher risk of having learning related difficulties such as dyslexia or dyscalculia. They're more prone to physical symptoms, psychosomatic symptoms, such as some of the ones that we mentioned, more prone to self injury behaviors. And they have difficulty, it seems, in forming and maintaining friendships and relationships due to a lot of the issues associated with their undiagnosed ADHD. There are some contextual factors I wanted to point out as well. Um, Research has actually looked into the influence of hormones, especially estrogen, in terms of fluctuations in hormone levels affecting symptom severity. Some of the things that have been found is that there's a noticeable increase in symptoms in the days prior to the start of menses or the period. Hormonal shifts that have been observed during puberty, pregnancy, postpartum, and even in menopause tend to intensify symptoms, for instance, in puberty, along with the feelings of sadness or rejection sensitive dysphoria. Social anxiety tends to show up when hormonal shifts occur in puberty. And all of the time, all of these symptoms are easily dismissed as just like growing pains, typical behaviors that the female is going through. She's likely to be emotional. She's at that age, that type of thing. Symptoms have been shown to intensify with the hormonal shift that occurs even between the first trimester of pregnancy and second trimester of pregnancy. There tends to be a sudden drop in the hormone levels. Also, there's always a certain sudden drop, I should say, in a female's hormone levels after she gives birth. So during that postpartum period, there has been a connection to postpartum depression and anxiety being a higher risk factor for females who have ADHD. In menopause, it's believed that the reduced levels of estrogen are actually contributing to, let's see, contributing to memory issues. Um, so again, this is it's something that, of course, further research is needed on it, but there has been research that has actually supported the belief that the drop in estrogen levels that naturally occurs at that stage of life worsens procrastination, affects time management habits. Memory problems are more likely to increase if they're not already present. And feelings of being overwhelmed and a greater sense of just overall disorganization tends to occur during that time. So the symptoms are being amplified, and it's been found to coincide with the low levels of estrogen. In terms of healthcare bias, there's just been a failure in a sense to, or in general, to recognize and accurately diagnose and treat. So this is creating a significant barrier for women to actually receive the effective treatment that they need to thrive in life. So let's look at some of the treatment options. Starting with the psychological evaluation, which is, of course, a tailored, comprehensive assessment to help secure an accurate diagnosis, and is actually the first step towards receiving the treatment that she needs. Counseling and psychotherapy, this is providing her with a safe and non-judgmental space so she can process, especially as a newly diagnosed female, helping this person to actually process the many different struggles they may have had throughout life, helping them come to terms with their diagnoses and how certain things are now explained with the diagnoses now, helping them explore and process how their life has been impacted to date, helping them prepare for the path forward. And it's actually a great source of empowerment. Um, Coaching is an option. We may actually have a coach here with us today, I believe, but ADHD coaching is a wonderful way to actually help individuals who are newly diagnosed or diagnosed and maybe just want to take a different approach to how they're managing their life right now with this particular disorder. It provides skills that are actually helping you identify and implement strategies to improve your daily life. And medication. So, of course, this is going to be under the care of a medical professional, a psychiatric professional, such as a psychiatrist or psychiatric nurse practitioner, or in some cases, the primary care physician. I've seen that occur where the primary care physician is the person who is actually prescribing medication to help manage the ADHD symptom. There are multiple categories that are used in terms of medications that are prescribed. Stimulants are the most often type of medication that is prescribed. That's been the one that's kind of occurred throughout history and is still the go-to in most situations. Although I have started to notice more individuals who are prescribed SSRIs or NDRIs or antidepressant medication as the first line to help with focus and attention related issues. There are also, like when we think of stimulants, I should say that's like your Adderall. Vyvanse are two of the most common ones that are out right now. But there are non-stimulant medications. Strattera is the one that comes to mind. It's always the one that kind of sticks out for me. But the bottom line is there are options. And one thing that I've learned also is that individuals may have to go through multiple types of medications, multiple different medications and dosages to get things to the point that the medication is actually helping them. But I encourage anyone who's faced with this decision to stick with it. It's going to be worth it. So, what can we do? Right? We want to become, in a sense, ADHD detectives. We want to question behaviors and difficulties that we see, especially as any of the clinicians on here, any students who are headed towards a career in this field. Question behaviors and difficulties in yourself. Question behaviors and difficulties you may have had. Ones that you've noticed in your female children. your friends, your colleagues, family members. But if you're a clinician, again, especially in your clients. So I encourage that we develop this sense of awareness, learning as much as you can about how ADHD shows up differently for our girls and women, and advocate. Right? We want to be that source of advocacy because this is an ongoing problem. And if we know anything about how certain things are affecting women in our society today, females in our society today, it's going to take a lot of us to actually advocate for increased change in all different areas. So, improve the diagnostic approach. Again, increasing awareness leads to this. Learn as much as you can about it. When you're considering as a clinician possible diagnoses, put all the pieces together. Consider difficulties in a holistic manner. Look at areas maybe that we haven't considered before, like injuries or childhood or work. Don't just think about childhood. Look at it throughout with as much history information as you can. We have to make sure that we're addressing any issues that are affecting us. And gender bias, of course, continues to do so. So even our DSM presents things in a way that is typical more often for the male patient or client with this disorder than females. So we have to kind of think outside the box when we're putting that picture together, and increasing your understanding and awareness of the unique ways that ADHD manifests in women, like you're doing today, will help improve diagnostic awareness and improve your diagnostic approach. And when you're improving in these ways, like I said, advocate. Don't just keep it to yourself. Share it with your colleagues, regardless of whether they're male or female or however they identify. Everyone needs to have this because we want to increase understanding of the unique ways that ADHD manifests in women. So have one last thing to share with you, and I'm also planning to put this on a job aid of sorts so that we can actually send it to you later. But these are just some common signs and symptoms of ADHD in women, and I look at it in all the different categories of the inattention symptoms, such as, again, seeing her frequently make mistakes or overlook details, having trouble staying focused or just zoning out. She's starting projects, but she's finishing them. And when we talk about focus, I want to make sure that I let you know today as well too. Doesn't mean that she can't focus, because individuals with ADHD tend to, as we see later on, there's a tendency to hyperfocus, which is one of the things that is listed on here under the hyperactivity and impulsivity commonly seen symptoms under item number 2. So watch for these things. Is there avoidance of boring tasks? Is she just not like this, even though, as a parent or as the caregiver or whomever you may be in their lives, this person has the capability to complete the task, but there's something missing. ADHD might be that missing links. Losing or misplacing items. Some of you might be like me thinking, I lose stuff on a daily basis. Like if my phone is not attached to me, I'm having to ping my Apple Watch to make sure that it tells me where it is. So some of these things make me think about myself. And I'm hoping that if you've had questions about things that are going on in your life, that maybe we've uncovered some information in today's presentation that will help you as well. But again, these are common signs and symptoms you can expect to see in women who may be undiagnosed and being affected by ADHD. The hyperactivity and impulsivity are less common, but look for different ways it shows up. Maybe she's not a daredevil, but she's doing other risky behaviors or impulsive behaviors that could be attributed to other things. Again, as I mentioned earlier, there's a tendency to attribute those types of disorders or those types of symptoms to things like personality disorder or even bipolar depression. All right, so I wanted to leave at least a couple of minutes to see if we have any questions, if anyone has anything that they want to ask or add. Um, Perfect. You're absolutely welcome. Thank you, Mercedes. So as I mentioned, I'm going to send out the information on the previous slide here with common signs and symptoms, and I'll have it sent out as soon as possible. Hopefully today I'll get it sent out. Um, we also have We also have services, of course. As I mentioned, I am currently a clinical intern at Magnolia. This is Magnolia Wellness and Psychology, working under the supervision of Dr. Tamara Edwards. And we offer services including ADHD evaluations, ADHD coaching, ADHD counseling, which will be glad to help you. And our information is included on the screen there on the slide. Send an email, go to the website, check it out, call, do whatever you need to. But if you are, or you know someone who may have been suffering in silence as a girl or a woman with these signs and symptoms of ADHD, don't let it go on any further. I encourage you to do something about it. So, thank you all for attending. I really appreciate you bearing with me today.